Federal authorities have charged 35 people in connection with a Medicare fraud scheme that preys on senior citizens' cancer fears. Among those charged are 10 medical professionals, including 9 doctors. You are seeing exclusive video of recruiters, lab owners, and doctors being targeted in raids for allegedly participating in the scheme. They're said to have billed Medicare nearly $2 billion in unnecessary genetic tests. Recruiters were enticing seniors to submit DNA samples for a genetic cancer risk test and telling them Medicare would foot the bill. But many say they never received results, and their Medicare accounts were billed for thousands of dollars. CBS News chief investigative correspondent Jim Axelrod has been reporting on this. Jim is here to interview Gary Cantrell. He is the Deputy Inspector General for Investigations at the Department of Health and Human Services. Jim, thank you so much for being here and doing this for us.
Tanya, thank you. And let's bring in Gary Cantrell right now. Mr. Cantrell, thanks for joining us.
Sure, thank you.
So let's start with today's action. It seems fairly extensive. Who were you targeting, and what are you alleging the people taken in today were doing in terms of taking advantage of seniors?
So we were targeting today individuals throughout the country who are preying on seniors to bill for medically unnecessary genetic tests. These schemes involved marketing companies, telemedicine, involved doctors, and involved labs. And they would, in essence, go out and target beneficiaries at health fairs or via the telephone or other means to identify Medicare patients, get their Medicare card number, get a swab, a cheek swab of some sort to collect their DNA, and then subsequently obtain a doctor's signature, a fraudulent signature for that order for the lab to then bill Medicare for thousands of dollars.
So what you needed here, almost in essence, it's sort of a three-legged stool. You need people to get the seniors the samples and their Medicare numbers. You need laboratories, which are going to actually bill Medicare. And you also need a doctor's signature to make it appear as though this test was medically necessary, which is what Medicare required in order for reimbursement. Is that right?
That's correct. The doctors are the gatekeepers here. Without that signature, none of this billing occurs and nothing is paid. And it's critical that this engagement with the patients, in this case, where there was zero to very little actual interaction with these patients, yet doctors in many of these cases signed off on these orders anyways. And so without that doctor's signature ordering that test, Medicare doesn't pay anything.
So
they have to be. Go ahead.
I want to get back to that in a second, but let's try to get our arms around the size of the action today. So somewhere near $2 billion in fraudulent billing is alleged to be what we're talking about here. How big is that compared to sort of other Medicare fraud cases that your office has worked on over the years?
It's one of the biggest, absolutely. This is a huge scheme. The reimbursements for this type of testing are very large compared to many other types of schemes that we see in the thousands of dollars per test. And so these individuals who participate in these schemes can make a lot of money very quickly. And so this is absolutely one of the biggest schemes we've targeted.
How long were you keeping your eye on this? In other words, how long from beginning to understand that perhaps there was an issue in terms of some kind of fraudulent activity and today's action? Weeks, months, years?
These types of actions, this type of coordinated enforcement takes months to prepare for. But I can tell you, through our investigations, we begin to hear about certain schemes emerging, and then we immediately go to our data analytics, and we look to see whether what we're hearing and seeing on the ground is reflected in the data, that Medicare claims data nationally. And in this case, we of course did that, and we try to identify the extent and the scope of these schemes, and target individuals who are perpetrating this fraud. All along working with our partners, other law enforcement partners, but also the Centers for Medicare and Medicaid Services directly as well.
So let me ask you this question, because in my reporting, I actually encountered one of the people who's named today, this Dr. Daniel Conchola in North Texas, who's alleged to have $69 million in fraudulent claims have his signature on it. Here's my question. In 2019, why can't Medicare have some sort of computer code that identifies this guy's name and signature has appeared on so many claims, maybe we ought to take a look. Why can't there be more aggressive vetting beforehand that might that might get to the heart of this before it spins off into $69 million in fraudulent claims?
Sure. I mean, that's an important question. It's a very small percentage of claims submitted to Medicare get any review prior to payment. The whole system is built around the trust of those doctors who are saying that these tests are medically necessary and paying them and those that are billing Medicare promptly. So there absolutely is data analytics that occurs against those Medicare claims as they come in, but the reality is very few claims are actually reviewed in advance of payment. But there are ways that we can, and that CMS can prevent some of this fraud once the full depth of this scheme is understood.
So is this a tip of the iceberg situation today? Will there be more activity, law enforcement activity based on this particular fraud?
Well, we expect that there will be more activity. There are certainly other investigations ongoing. We continue to receive complaints from the public, individuals reporting that they've been subject to this scam and haven't received any results. So we will continue to follow up on those complaints as we receive them, and again, using our analytics to identify any potentially fraudulent billing.
Gary Cantrell from Health and Human Services, Deputy IG, thank you very much for being with us.
Thank you.
Tanya?
Very interesting conversation there, Jim. What stood out to you from the Inspector General? I loved your question about why there can't be some computerized system in place that just notices when there are multiple names that come up again and again.
Well, as we were reporting on this, we learned that that some of this is built into the very fabric of Medicare and Medicaid. That in the beginning, when the systems were implemented in the 60s, they had to get doctors on board. So the ethic of the Medicare system was pay, and that was 50 years ago. Perhaps there needs to be some additional ability to look at how these payments are being made, not just pay first, but as we were just talking to the Inspector General about, perhaps implement some sort of computer code so that you can say, hey, wait a minute, this guy's name appears everywhere. How could he possibly be delivering the kind of care that would be necessary for us to make payment on this?
Some safeguard level seems to be warranted there. Jim Axelrod, thank you so much. Excellent reporting on this. Thanks for sharing with us.